Welcome to the Research Collective, your podcast for the latest public health research and insights on today's most pressing public health challenges. In the second part of our metabolic syndrome series, join us as we learn more about the impact metabolic syndrome can have on the sleep health among adolescents and young adults in the United States.
Hey everyone, welcome back to the Research Collective. I'm your host, Asha, and today we're diving into part 2 of our Metabolic Syndrome series. Last time, we broke down what metabolic syndrome is, that tricky cluster of conditions like high blood sugar, high blood pressure, excess fat around the waist, and abnormal cholesterol levels. These factors all raise the risk of heart disease, diabetes, and stroke. But today, we're connecting the dots between metabolic health and something you might not immediately think of, sleep apnea. And we're doing it with our podcast founder, Deepali Ernest, who recently published a paper on this very important topic, and co-founding member, Bipin Singh. Welcome, Deepali and Bipin.
Glad to be here, Asha.
Likewise, it's nice to be here on the other side of mic this time.
Deepali, let's jump right in. Your paper titled Relationship Between Sleep Apnea Symptoms and Metabolic Syndrome Among Racially and Ethnically Diverse Adolescents and Young Adults in the United States was published in Obesity Science and Practice, and it is such an important study. Can you tell our listeners what inspired this research?
Of course. So, I've always been interested in the intersection of chronic diseases and health disparities. And it just so happened that when I began working as a doctoral trainee with my mentor and now dissertation supervisor, her work was heavily focused on metabolic health conditions and racial and ethnic disparities, specifically in pediatric and adolescent populations. So she's made some amazing contributions to this field of study and still continues to do so. So the first project that I ever worked with her on was the project on metabolic syndrome and sleep apnea. And sleep disorders like sleep apnea are often underdiagnosed, especially in young populations and communities of color. But sleep is deeply connected to metabolic health. So overall, we wanted to explore whether symptoms of sleep apnea, like snoring, breath cessation, daytime sleepiness, were related to metabolic syndrome, specifically in adolescents and young adults in the US.
I love the personal angle to your research. Now, I find it interesting y'all focused on adolescents and young adults. People usually think of sleep apnea as an issue for older adults, right?
Exactly. And that's precisely why we chose this age range. So, sleep apnea symptoms do show up in younger populations, and they're often missed or even dismissed. So, for our study, we used data from the National Health and Nutrition Examination Survey. We call it NHANES, which includes self-reported sleep apnea symptoms, metabolic health measures, and demographic information. And this is a nationally conducted survey or study. And so it's a really robust source of national data.
Nice. That's super interesting. Now, Bipin, I know you've read Deepali's paper and you have also published a few papers using this data. So maybe you could give us some insight into what the NHANES data is like and what the researchers were focusing on in this study.
Sure, Asa. So, those of you who don't know about NHANES, stand for National Health and Nutrition Examination Survey, and this enhanced data is a large, publicly available US-based data set which is collected in every 2-year cycle. And the benefit of this data set is that it is a representative of the larger US population and has extensive information on various different aspects of health behavior, outcomes, and biomarker data. So, for this sleep apnea study, they analyzed enhanced data for adolescents and young adults between the age group of 16 to 25 years. And from my understanding, they looked at 3 main symptoms of sleep apnea, which are snoring, breath cessation while asleep, and daytime sleepiness. and they defined metabolic syndrome using clinical criteria like elevated waist circumference, elevated triglyceride, low HDL cholesterol, high blood pressure, and high fasting glucose. And so the researcher also looked at the association between the sleep apnea symptoms and metabolic syndrome while accounting for basic differences in age, sex, and race or ethnicity.
Wow, that's very interesting. And so, Deepali, what were your research findings? I'm curious what stood out to you the most in the results.
The study that we did was quite interesting. It had a lot of very niche insights into the association between metabolic syndrome and sleep apnea in this diverse sample of young adults. And so the most striking finding I would say was that central obesity or abdominal obesity was a consistent predictor of overall sleep apnea symptoms, of breath cessation, and daytime sleepiness. And this was after we controlled, like Bipin said, for basic demographics like age, gender, race, and ethnicity. So it wasn't just that people were overweight and tired, sleepiness itself was linked to worse metabolic health outcomes.
Yeah, and that's especially interesting because daytime sleepiness is often brushed off as just being tired or stressed, but it might actually be a marker for something deeper going on physiologically.
That's huge, especially for young people who may not recognize their fatigue as a health concern. Did you see any differences by race or ethnicity?
We did. So, for instance, non Hispanic Black individuals with metabolic syndrome had a fourfold increase in the odds of overall sleep apnea symptoms, which in the public health field is huge. In addition to that, we saw a 6 times higher likelihood of experiencing snoring among these non Hispanic Black individuals and an 8 times higher odds of experiencing breath cessation, which is either gasping for air or completely like stopping to breathe when you are asleep, which is, if you think about it, a bit scary. And so there are certain racial and ethnic minorities that do have increased odds of such outcomes compared to other race and ethnic groups.
That's a red flag. It seems like there are layers of risk here, both biological and structural.
Precisely. Social determinants of health, like access to healthcare, environmental exposures to toxins, stressors, which can come either from like, social settings, healthcare settings, work settings, neighborhood conditions like safety or air pollution. All of these things play a role. And as we've talked about before, there are certain subgroups in our population that are more likely to live in areas with, say, high air pollution, low income. And so it's important for us to take those factors into consideration in a study like this, where we're looking at sleep health outcomes and metabolic health.
So, Bipin, what are the public health implications of this research? How should we be thinking differently about screening or prevention?
Great question, Asa. So I think one takeaway is that we need to be more proactive about asking young people about their sleep, especially those who are at risk for chronic diseases. Even just a quick screen during a checkup, like asking few questions like, are you feeling excessively sleepy during that day, could flag someone for further evaluation. Also, there's a need for more equity in sleep healthcare, such as making sure underserved community have access to diagnosis and treatment.
Absolutely. It sounds like improving sleep health might be a powerful and underutilized tool in preventing metabolic syndrome. Before we wrap up, what's next for you both? Any follow up studies in the pipeline?
Yes, I'm interested in the intersection of sleep health and physical activity and how they jointly contribute to metabolic health outcomes like obesity. As you may recall, I am a PhD candidate in epidemiology and I'm looking at currently in my dissertation project focusing on how these three things are interrelated and impact people living in the US.
Yeah, that sounds like a really great project, Bipin, and hopefully we'll get to hear more about it from you in future episodes of the podcast. But Asha, on my end, I'm looking forward to looking at how the trends in metabolic syndrome and sleep apnea have changed over time. So, for the paper that we published, it was with data from slightly older years. And so I'm looking forward to using maybe recent years like 2023 to 2025 to see how it's changed over the past decade. So, more to come on that.
Well, we'll definitely want to bring you back for future episodes. This has been such a fascinating conversation, y'all. As always, it's time for our myth or fact section. First question: having metabolic syndrome increases your risk of snoring and other breathing problems during sleep.
Definitely a fact. If our listeners are taking away anything from our podcast today, I would hope that they see the link between metabolic health and sleep health. Metabolic syndrome is linked to increased fat deposits around the neck and also airway inflammation, which can lead to snoring and eventually obstructive sleep apnea. So, definitely a fact.
How about this statement? Young adults with metabolic syndrome are less likely to experience daytime sleepiness.
This is a myth. In fact, metabolic syndrome is associated with poor sleep quality and breathing disturbance that can cause excessive daytime sleepiness.
Lastly, metabolic syndrome can cause episodes where breathing stops temporarily during sleep, otherwise known as sleep apnea.
Again, this is a fact. Metabolic syndrome significantly raises the risk of obstructive sleep apnea, which one of its characteristics is breathing stops temporarily during sleep or breath cessation. So, definitely a fact.
All right. Well, that was a short but super informative episode on the link between metabolic syndrome and sleep outcomes. For our listeners who'd like to read this research paper, we'll be sharing a link to the paper in the comments below and on our Instagram page. Also, stay tuned for part 3 of our metabolic syndrome series, where we'll explore the impact of metabolic health on polycystic ovarian syndrome. Until then, stay healthy and stay curious. If you enjoyed today's episode, be sure to drop a like or comment below. Follow us on Instagram, YouTube, and Spotify, and share it with a friend.